Can you talk us through the figures and what this actually means for New South Wales and Sydney going forward?
Well, what it means is for vaccinated people, there are brighter times ahead in New South Wales in October. But for critical care staff, doctors, nurses, paramedics, possibly some of the most challenging times of their entire careers are on the horizon. Today, 177 people are in ICU at the moment. They're expecting a peak of COVID-positive patients requiring ICU, possibly late October into early November, of around 560. That's more than 3 times what we're seeing today. And of course, we've already seen scenes at places like Westmead Hospital where you've got 11 ambulances bagged up with COVID-positive patients waiting sometimes over 6 hours to unload. The ambulance crews are going to be really critical in this plan in order to deal with this surge capacity, because they're going to have to transport patients away from their nearest hospital as well. And this will be monitored in real time, along with making sure staff have breaks, but also requiring them to undertake extra training as well. And they've been running simulations in hospital, and hospitals have been talking through with health bureaucrats as to what other parts of the hospital may be used for this surge capacity. And they've got a surge capacity in the number of beds up to 1,550. According to Dr Nguyen, who is from the Department of Intensive Care at Nepean Hospital, there are challenging times ahead, but they will get through it.
Does it worry us as a critical care community? Of course it does. Is this the biggest challenge that we're going to have as a health system? And will we be in crisis? I'm really confident that we have plans in place.
Now, despite these worrying figures of the amount of hospitalisations and people requiring ICU beds later this year, the Premier says this does not impact the plan to start opening the state to fully vaccinated people once we hit that 70% double dose target, which is going to be sometime in October. Here's more of what she had to say on that.
When we do open up at 70% double dose, anyone who interacts with each other will be completely vaccinated. So that massively reduces the chance of anybody requiring hospitalisation. So what you have in front of you is what we best anticipate will occur, but that is why the Doherty modelling, the plan that the national plan is based on, the modelling, the research that the national plan is based on, assumes, which is the case, that high rates of vaccination prevent people from coming into hospital.
So, Tom, what has been revealed is that this modelling that the state government is going off to determine case numbers and predicting hospitalisations doesn't take into account the opening up strategy, but does take in the amount of people that are going to get vaccinated, as well as the case numbers that are predicted. But also, how many people are going to be in hospital, that may change depending on whether there's any super spreader events, they said. So difficult times ahead for healthcare workers in New South Wales, Tom.